Imagine you've just finished eating and you've washed your hands. But as you sit down, you feel like your hands aren't clean enough. Reluctantly, you go back and wash them again. Once you are done, and just as you sit back down, the doubt hits you again. You try to brush it off. I've just washed them twice, they're clean. But the thought of some leftover germs bugs you. You start at your hands and think, maybe I missed a spot. Even though you know it's irrational, you feel restless. Maybe another wash will help. So you do it. Back to what you were doing. But after a few minutes you think, did I use enough soap the last time? Stop overthinking, you tell yourself. Of course I did. Let it go. But the thought stays. You visualize germs crawling all over. Okay, one more wash, just to be completely sure, you convince yourself. So you wash your hands again. Sounds familiar? Sure, an average person knows their hands are clean. Someone with obsessive-compulsive disorder knows that too, but the thoughts keep coming back, often for hours, because it doesn't feel right. That feeling is stronger than logic, so the urge to wash is hard to resist. It's typical for OCD, often called obsession, a nagging unease that you can't shake off even though you know better. So you find relief in another way by washing, checking, organizing, or trying to be perfect. In psychology, this is called a compulsion. Obsessive-compulsive disorder sounds complicated, but you might have heard it called OCD. Imagine someone who every time they leave a room has a flick the light switch on and off 5 times. Not because they want to, but because they feel they have to. That's a bit of what it's like. It's repetitive, tiresome, and definitely not fun. OCD is like having a song stuck in your head that just won't go away, no matter how hard you try. Think of it like an itch on your nose during an important meeting, and you are trying hard not to scratch it. But the itchiness grows until you just can't help but scratch. Now imagine this every time you use a public restroom. You wash your hands exactly 12 times afterward, or you feel something bad will happen. Or picture someone who can't step on cracks on the sidewalk, thinking it will cause harm to a loved one. Around 1 to 3 out of every 100 people might have these kind of thoughts or habits. And if we count problems that are a bit similar, like someone who spends hours each day thinking they look strange, or who can't stop picking a tiny spot on their skin, the number grows. But many people don't even know they have it. Most start feeling this way when they're pretty young, often before they even become teenagers. It's like having a backpack of worries that gets heavier over time, but not everyone realizes they're carrying it. Everyone sometimes worries unnecessary. Oh no, did I turn off the tap? Do I have my passport with me? Or am I overlooking something? Such thoughts are very normal. OCD only occurs when the symptoms are so much or so intense that it disrupts someone's well-being or functioning. The official threshold is at least 1 hour, but often it's much more. For someone with OCD, tiny worries can feel gigantic. It's like spilling a drop of milk and fearing an entire flood will follow. Or like seeing a single ant and fearing there is a massive army of ants hiding nearby. Sometimes these fears feel like huge warning alarms in their minds. But I want to stress this. It's not always about fear. It might just be a very loud, nagging voice saying something not quite right. Years ago, people used to think OCD was like a puzzle inside someone's mind, like an unsolved inner problems. But trying to find and fix those problems doesn't really help. The real reason people have OCD is still a bit of mystery. But we know that if someone in your family has it, there is a bigger chance you might too. And sometimes it's life's random events, like a traumatic experience or even something happening in the body that can trigger it. Obsessive anxious thoughts can show up in many ways. Firstly, there is a fear-driven worry about the likelihood of something bad happening. The most common types of compulsion includes fear of contamination, the fear of getting infected, spreading germs to others, or being disgusted by others. Another form is the need to check. Checking to prevent an unfortunate event or to make sure it hasn't happened. For instance, going back to check if you haven't accidentally hit someone. Other symptoms include disturbing, intrusive thoughts, not being able to throw things away, a compulsion to count things a certain number of times, or needing to do things symmetrically or in a perfect manner. But OCD can manifest in many other ways. People can feel upset about things they might do because they have unwelcome thoughts about actions they strongly disagree with. These thoughts might involve being aggressive or sexual, harming themselves, saying blasphemous things, sexist or racist thoughts. An example of this is perinatal OCD, an obsessive fear in mothers and also fathers of harming their newborn baby. Another example includes thoughts like, "My mother is a slut," or "God is a jerk." People might also feel upset thinking they could cause bad things to happen by what they do or by forgetting to do something. For instance, a nurse constantly fears forgetting things or making mistakes. Also, people worry about bad things that could happen to them, like losing someone they care about, getting very sick, fires, catching diseases, or feeling like they look bad. Additionally, in people with OCD, there can be a sense of unease about small imperfections and how things look, how tidy they are, or whether tasks are done perfectly. They become restless when things don't seem perfect, if they are not in their proper place, not symmetrical, or not done in the right way. For instance, a person might feel the need to rearrange books multiple times until they feel right on a shelf. Compulsively picking at the skin or pulling out hair may also emerge from the need to address perceived imperfections or discomforts. OCD can manifest as an intense discomfort when something feels incomplete or out of place. Often, individuals with OCD go to lengths to avoid scenarios that might provoke these feelings. For instance, some might avoid being alone with children, not due to any genuine intent, but because of unwanted and distressing intrusive thoughts related to pedophilia. These are involuntary thoughts, and people with OCD recognize them as irrational and do not act on them. When someone with OCD doesn't know better, they often try to get rid of their worries by doing their repetitive actions. But this can make things worse. It's like trying to wash your hands all the time or always checking things over and over. The more you try to make everything perfect, the more upset you get about small mistakes. The more you check, the more you feel you need to. OCD can be treated. It might not always go away completely, but treatment can help a lot. Some people might get better fast, while others might take a longer time. And sometimes, even after getting better, some people might face difficulties again. That's okay, and it's part of the process. OCD can be treated with psychotherapy. This is where a person talks to a therapist to understand their OCD and learn ways to cope. One common method is called exposure and response prevention, which is a form of CBT, cognitive behavioral therapy. During this therapy, you'll gradually face the things that make you anxious, without following through with the usual habits to soothe that anxiety. Together with your therapist, you'll rank these triggers from last to most distressing, starting with the less anxieties, like if you have an urge to check if the stove is off multiple times. You might be asked to only check once and then resist checking again. The process helps you realize that it's alright not to give in to every urge. It feels a bit like getting into a pool with cold water. It's uncomfortable at first, but then you adjust. With time and your therapist's guidance, these compulsive urges can lessen or become easier to manage. CBT also helps to recognize that our brain can sometimes give misleading signals. While many can brush off these thoughts as just passing nonsense, some with OCD might give these thoughts too much importance. Instead of just dismissing them, they might feel guilty or bad about having such thoughts. However, studies show that trying too hard to push these thoughts away can make them pop up even more. Some people with really strong OCD symptoms might need medicine. These medicines help calm their mind and reduce the urges. Often both psychotherapy and medicine are used together. This can give the best results for many. Transcranial magnetic stimulation is a non-invasive procedure that uses magnetic fields to stimulate certain areas of the brain. It can be used for OCD treatment in certain cases. And for severe cases of OCD that doesn't respond to conventional treatment, deep brain stimulation might be an option. This involves surgery, implanting electrodes in specific areas of the brain. Techniques such as meditation, deep breathing exercises, and journaling can sometimes help manage OCD symptoms, although they should be considered complementary to the main treatments like CBT and medication. So OCD is not a sign of weakness or a character flaw. It's a real complex disorder. But with knowledge, understanding, and the right treatment, people with OCD can lead fulfilling lives. Thank you for joining me today. I hope this information has been valuable to you. Don't forget to like, share, and subscribe for more updates. Until next time, take care.